Hello, dear friends. Today's conversation is about hair loss and baldness. This topic is of equal concern to both men and women, but we will focus more on women because it is a cosmetic defect, and all women are very closely monitoring the condition of their hair. I've rarely seen women who are completely happy with their hair looks. To understand what we will talk about, let's look at what the hair growth cycle is all about. There are 3 phases of hair growth. The first phase is anagen, which is the division of cells at the root of the hair that makes the hair grow. This phase lasts from 2 to 6 years, and this is the life of the hair. The second phase is catagen, a transitional phase that lasts only 3 weeks, from cell reproduction to dying. That's a very simplified way of putting it. The third phase is called telogen. At this stage, the hair shaft is already completely dead. In addition, the bulb itself is dead, and nothing divides in the papilla of the hair follicle. Simply put, the hair stands like a tree with its roots cut off, but for a while, it is still standing. This phase usually lasts about 3 months. Depending on which phase of hair growth has been affected and will be, there is a different clinical picture of hair loss. The anagen and telogen phases are affected by very different factors. The hair growth phase is affected by radiation and chemotherapy. It is seen in those patients who receive treatment for cancer and intoxication with heavy metal salts. The second reason, which is highly prevalent, is androgenic alopecia. It is believed that androgen, that is, male sex hormones, particularly testosterone and its more active derivative, dihydrotestosterone, cause the changes that cause baldness in both men and women. In women, however, baldness develops in a female pattern. In men, it often causes an M-shaped characteristic of hair loss with balding, with baldness forming on the top of the head. In women, it is the so-called female type of androgenetic alopecia, characterized by baldness that mainly occurs through hair thinning in the parking area. There are several variations of alopecia areata. Usually it is the parting, but some far advanced cases have hair loss on the temples. Apart from the above factors, various stressors can also act on hair loss. For example, it can be pregnancy, breastfeeding, some medications, some oral contraceptives, and blood pressure medications. These factors can cause a decrease in the lifespan of the hair and more hair loss. For example, in some conditions that are accompanied by hormonal imbalance, such as thyroid disorders and hypothyroidism, there can also be a disorder of pituitary function, hyperprolactinemia. In addition, there may be various disorders of female sex hormones, such as estradiol insufficiency. Also, the cause of hair loss may be a lack of some vitamins and minerals. For example, it may be iron, zinc, or biotin. Conversely, an increased intake of vitamin A can also lead to hair loss. So, how is all this dealt with? First, of course, look at the nature of hair loss in the patient. By looking at how the hair falls out, in what order, and in places, you can suspect whether the hair loss is androgenic, meaning the cause was a hormonal imbalance. Or it may be other causes, for example, skin diseases, deficiency of some vitamins and minerals, fungal disorders, manifestations of systemic severe illnesses, or the effects of chemotherapy. In addition to the fact that all of this is obvious, we must also define what is excessive hair loss. It is acceptable for a person to lose 100 hairs per day. How is this usually tested? There is a test when the patient is asked for 14 days to collect hair, each day in a separate bag, in the morning after combing. Normally, a gentle pull-up should not leave more than 3 strands of hair on the arms, but after shampooing, loss of up to 250 strands of hair daily is acceptable. After 14 days, the bags are taken to a doctor or laboratory where the characteristics of the root of the hair are studied to determine in which phase the hair falls out, in the stage androgenetic or telogenetic. This test has significant diagnostic value. In addition to an external examination, reviewing medical histories, and counting hair loss per day, there are some other relatively simple tests. The first test is to pull up a strand of hair, about 40 hairs in a bundle, in 3 different places. Normally, when gently pulling up, no more than 3 hairs should be left on the arms. If more, it means there's a suggestion of excessive hair loss in the telogen phase. The next test is more rigid. It is called the pinch test. About 50 hairs are plucked from the root, and then these roots are examined under a microscope. As a result of this test, we can determine what phase the hair we plucked was in. Normally, about 90% should be in the anagen phase, that is, living, dividing hair. If the percentage is lower, we say that the hair loss occurs in the telogen phase and vice versa. If the number of anagenic strands of hair increases, we can clearly understand that the person has problems in the reproduction phase of the hair. Another test is a biopsy. Biopsy is often not resorted to, but only when the causes of hair loss are not obvious. It may be some scarring changes or changes due to infectious, particularly fungal lesions. Sometimes this is a symptom of systemic diseases, such as systemic lupus erythematosus. Therefore, to better understand and differentiate whether it is androgenetic alopecia or some other, a biopsy of the skin with hair is performed. There is another non-invasive method, which is trichoscopy. It is the hair and scalp examination under a magnification of 10 or 30 times. Here, we can see the irregular diameter of the hair. In androgenic alopecia, we can also see empty follicles. After determining what kind of alopecia and questioning the patient, a variety of biochemical and hormonal tests are prescribed. In women, of course, the analysis of total testosterone, free testosterone, for globulin-binding sex hormones. These hormones regulate the menstrual cycle, estradiol, progesterone follicle-stimulating or tonic hormone, prolactin, etc. The study of these hormones is always scheduled on certain days of the cycle and under certain conditions. In addition to hormones, insulin levels, and glycated hemoglobin, some vitamins are also studied. It is obligatory to examine the ferritin level and transferrin to determine the iron level in the blood. All of this is to identify all possible causes of hair loss. It is often the case that one form of hair loss, for example androgenic alopecia, is adjacent to iron deficiency anemia. In this case, it is necessary to act in both directions. So, how does the treatment of hair loss take place? It happens according to the cause detected at the previous stage. If the hair loss is due to vitamin and mineral deficiencies, nutritional disorders, diseases, and so on, in this case, everything is clear. Namely, if there is an iron deficiency, we prescribe iron. Biotin deficiency, prescribe biotin. Zinc deficiency, prescribe zinc, etc. Everything is good here. There's a clear plan. If there are any hormonal processes disturbed, such as hypothyroidism, for example, substitution therapy with thyroid hormone preparations is prescribed. If there is evidence of an increase in the testosterone level or any other androgenic hormones, prescribe drugs that block the transition of testosterone into the active form. These are the 5 alpha reductase inhibitors. For example, if a deficiency of estradiol is detected, which is often associated with a violation of the menstrual cycle, it is equalized with specific drugs. Sometimes contraceptives with anti-androgenic effects are used. In the case of elevated insulin levels, a diet is prescribed, which reduces the insulin level, and so on. All these issues, of course, should be dealt with by a doctor, not by you. Apart from specific treatments, there are also non-specific treatments that enhance hair growth. For example, minoxidil is a drug used to treat blood pressure. However, its strange quality of enhancing hair growth was discovered. So it is, in 2 or 5% form, successfully applied locally. But its main disadvantage is that if you quit using it, the alopecia will return. Even good results have been achieved with laser treatment. Laser radiation has a stimulating effect on hair growth. A surgical hair transplant is a perfect method. It is especially effective in severe cases where there are no longer any follicles and no hope of resuming hair growth. Hair transplantation is a good option. The treatment with one's own tissues is the following method. The use of platelet-rich plasma has already been approved in many countries. It is a procedure where blood is taken from a person and prepared in a specific way to make a platelet concentrate from whole blood. The concentrate must be of a defined proportion. For example, if a person normally has 200-300 multiplied by 10 to the 9th degree of a liter concentration of platelets, then when preparing plasma enriched with platelets, we raise this concentration 5 times. I will show you now the analysis made after I received platelet-rich plasma. As a result, we received in the blood 1,031 by 10 to the 9th degree platelets per liter, which is a good indicator. This plasma enriched with platelets is injected into places with hair loss. Such plasma contains many growth factors. The mechanism of action of this platelet-rich plasma is not completely clear. However, it is believed that multiple growth factors activate dormant follicles, which subsequently give growth to the hair. In addition, other mechanisms are involved, particularly the differentiation of keratinocyte cells, precursors of hair follicles, and so on. There is another method which has also appeared recently. It is the use of its fat. In this method, the stromal vascular fraction is obtained from the patient's fat when the fat is taken from the patient, for example, from the abdomen. Specifically, this fat is centrifuged and passed through several sieves. The fat cells burst during this process, leaving a pure stromal vascular fraction, a mixture of vessels, fibroblasts, stem cells, fat, and other components. This stromal vascular fraction, dissolved in a fat emulsion, is also injected into the areas with the most pronounced baldness, and a perfect effect is achieved. At the same time, the hair growth in these places is resumed. It is brief information about the causes of hair loss and the treatment methods. I want to note that such a specialization as a trichologist among the nomenclature of medical specialties, no. That is, it is a fictitious specialization. As you may have noticed from my story, hair loss is a multidisciplinary issue affecting equally general practitioners. After all, it is to them that a patient comes for the first time with hair loss complaints. It also applies to other specialists, endocrinologists, surgeons, dermatologists, and gynecologists. To properly assess the cause of hair loss and to properly develop a treatment, it is necessary to delve into various related fields quite seriously. I thank you for watching this video to the end. Always for you, Dr. Popmed.